one key element of this medicine, and one of the big reasons why I feel it's very unique, is that we determine what we're going to treat exclusively by what the nervous system tells us. Most of the time, you're going to find points on the ear that are active that relate to a specific symptom. But a lot of times, you're also going to find points that don't seem to relate to the symptom at all. What this indicates is an associated element of the treatment that you might not have thought about. So we really try and take our idea of what we think we're going to treat as much out of our mind as we can. Clearly, we want to have an idea of what the symptoms are and what our goals are in the treatment, that kind of thing. But in terms of the points that come up, what I want to talk about is trusting what you find, because in a lot of the approaches in Chinese medicine and in conventional medicine, we take the symptom picture. So we, in whatever ways that we're getting the symptom picture or the diagnosis or the assessment, we're saying, okay, so here are the details about how this person is ill and why they're ill. And so here is a recipe of a combination of points or herbs or those kinds of things that I would then apply to this patient. And so when we do it that way, it's very effective a lot of the time. However, we're not really taking advantage of the nervous system of the patient, in the sense that we're not asking the nervous system of the patient directly what is the best treatment. So no matter how brilliant of a practitioner you are, and no matter how many modalities you've studied, no matter how well you know the nervous system of the human body, if you find an active point that relates to, let's say, a shoulder point, and they have no shoulder symptoms, it relates to a knee point and they have no knee symptoms, nothing that they can think of, then there is a weakness there, perhaps from an old injury that is not part of what they're thinking about. There's a weakness there that is currently affecting that patient. And it's something that perhaps wouldn't have ever been in that patient's history. You see, they might not have ever written it down. They might not have ever told you about it, because to them, it wasn't that important, or it was something that happened a long time ago, and they think, well, it's not recent, so it doesn't really matter that much. But the ear is telling me that there is a connection here, okay? That this knee is important in this picture, right? And perhaps in some cases, you ask them about the knee and they'll say, well, nothing ever happened to my knee. I don't know what you're talking about. And in that case, you want to also consider that there is an old injury or something that happened to the knee that they just don't remember. And some trauma, especially if it's early on in life, is completely outside of the conscious memory of the patient. One of the first things that I say in the level 1 training is that the ear is a map of the brain, okay? But it's a dynamic map, meaning it will only show you what is currently affecting the system. So that means if you find a point from 25 years ago, it can only be because it's still affecting that person. In this we get into focus activity, and I want to introduce that idea as an example for today of how important it is to trust what you find, because you don't have the whole story. Your patient doesn't have the whole story, even though it's about them. They don't have the whole story. Their doctors don't have the whole story. Even if you put all of that information together of what you know, their doctors know, what they know, you still have a very small part of the story. But their brain, the patient's nervous system, is holding the whole story. You see, we just typically can't access that much of what's going on in the brain. It's just a matter of us, the auricular practitioners, learning how to access that information. And this is why we have, level 1, level 2, level 3. And of course, as you've seen in level 3 with Dr. Barr, that we go so far as to find past life traumas, that are affecting the person. And so, that's very far away from what we're talking about now, but it's on the same trajectory in the sense that everything is on the ear. And if we learn to really hone in and trust what we're finding, even though it's beyond what we understand as a practitioner, then we're going to be a much more able to help the patient because we are actually letting go of our own idea of what is going to be wrong with this person. It becomes a much more individualized approach and a much more subtle approach. And if you're taking this approach, it is more challenging to do a research that is depending on having a very set protocol. But that's kind of the beauty of it as well, because now we have the ability to really just open up our minds and allow the information to come, the truth to come forward from the patient. So that element is really a key piece. This entire medicine is based on that. So I wanted to say that before the next part of what I wanted to talk about, because when I start talking about points to look for, it's very different than a lot of approaches where you say, okay, here's the addiction protocol. Here's the, here is the induction, birth and labor induction protocol. Here is the immune system protocol. Okay, so we don't work that way, but there are certain points that you would look for. Okay, so if you name any condition, any symptom, there are going to be a collection of points that are going to be good ones to go searching for. Whether you're using the hammer and the vase, or the point of select, or simply pressure, you're going to be only treating the points that are active. And I want to say that what I'd like us to really start working on is not only just treating the points that are active, but treating the points that are the most active. Because if you got someone in a lot of pain, you might find 4 or 5 different pain points that are active. Okay, how do we decide which ones are going to be the most effective to treat? Part of the decision is going to be based on how active the points are. Okay, and if you're just poking with tenderness, then it's with the same amount of pressure, which points are the most tender? Very simple, right? If you're using the point finder, you've got a scale of 1 to 16 that tells you how strong that point is. And if you're using the vase, then you can, once you get used to feeling the vase, then you can really determine from the strength of that pulse reaction which of those points are the priority. Okay, as we get into level 2, there are ways that we can prioritize those symptom points as well using other tools, and I'll introduce those at another time. For now, we can just determine the strength of the points, and that can be part of how we think about the priorities. Does everybody have a copy of this book? The second edition. I wanted to guide you to chapter 9. It's called Indications. It starts on page 336. This is a really interesting section because what Dr. Strittmatter has done is she has taken some of the more common conditions that she's dealt with in her practice, and she has given you suggestions of what points to look for. So again, these are not protocols by any means. They're simply points to look for. Of course, not all the conditions are here. just the ones that she felt at that time were the more common ones that she's dealt with, that she had some insight about. By no means does it mean that these are the only points that you would look for. There are many others perhaps that you would look for. And when I look at these, I can think of 5 or 6 more points that I would look for as well. But I want to talk a little bit about some of the conditions that you're dealing with specifically.
Beata, do you guys work with multiple myeloma?
Yes.
And do you treat it by boosting the immune system, by maybe boosting the red blood cells, I would think, because they're being crowded out by the plasma cells? Do you have any suggestions for treating it?
It would be very difficult to answer that because we do so much. We use a lot of ozone, we use high dose vitamin C, we use a lot of boosters that come from Europe, from Germany, that are made from basically organotherapy. So it's very difficult to answer, but we also use something called insulin potentiation therapy. So if you imagine cancer cells as a high metabolic cells, that's why they say they require lots of sugar, glucose. If you think of that, and now if you get somebody fasting and then you inject a little bit of insulin to even make that blood sugar low, and then you give a little bit of chemo, maybe just 5% with glucose. Now, guess who's going to grab it first? So this way it's very targeted treatment. So we do use low dose chemos because those drugs were developed to treat different cancers. They're very sophisticated, but the problem is they're very toxic. However, if you do it this method, you basically only treating cancer with chemo. You avoid treating the healthy cells because yes, they are fasting, they have a need for sugar, but not as huge as cancer cell. So it will basically, the treatment is very targeted. It goes where the cancer is. And then in the same time, you do a lot of boosting immune system. We use a lot of glutathione IVs, alpha lipoic acid. So you boost the systems. And another thing we do a lot is we detoxify, we stimulate, we sort of have treatments for lymphatic system. We have treatments for, hyperthermia. We do, it's a lot. It's a lot that we do. There's not like one single treatment, for myeloma, we do this. It's very individualized because again, we take consideration. There is a lot of homeopathy involved. Yeah.
Thank you.
One of the wonderful things about that I see in these classes is the connections that are made, and so it's really everybody brings such a unique perspective and such a unique set of experiences to it, and so that's one of the beautiful things about it. So I'm glad that we can recreate that online. That's nice. Amelia, you were talking about treating a lot of pregnant women, right? So yeah. you deal a lot with that, and so what kinds of conditions might you come across a lot?
The patients come in the clinic for fertility treatments, and during the pregnancy, I treat various symptoms associated with the stage of pregnancy. And then towards the end of the pregnancy, after 37 weeks of pregnancy, I prepare the body for the delivery. I also have patients with high-risk pregnancies. We can help for the side effects of the medication. If we integrate more and more therapies with the conventional medicine, I think we can help.
Yeah.
For emotional conditions, because it's quite intense, the process. the patients feel abandoned, and they feel they are numbers instead of being,
Right.
taken care individually, and that's one of the things to be improved in the medical system, the human part, which is very, very important. I see people coming from basically all over the world. It's becoming more and more the same thing all over the world. Less time with the patient, and as I said, I think in therapy, it's very important, the human contact.
From my experience from an auricular perspective, you mentioned preparing the woman's body for delivering the baby. So, and I would do this in especially in induction. So like if somebody is a little bit overdue and they want to have the baby before they have to be induced chemically. This is the approach that I usually will take. I think of it as three different elements, and one is hormonal. And so the hormonal element that I focus on is treating a point for oxytocin. One of the uses is to help with lactation, but another use is that it's a relaxing hormone that is present in the birthing process.
Very, very important to have regularly contractions during the delivery.
Right, exactly. So if you treat the oxytocin point, of course, again, if it's active, but typically it will be active in this case. If you have someone who's ready to give birth, by treating it, you're going to balance the system, the hormonal system that is regulating the release of oxytocin, which is really helpful. On the same page, 137 is a point called gonadotropin. It regulates the balance of estrogen and progesterone. This is helpful in a lot of situations. For this particular situation, I really like treating it because it helps to take the body from where it is to a place that's more balanced in terms of the estrogen and progesterone. So you don't have to necessarily know which is high, which is low for this person, where the imbalance is going, in order to say, okay, I need to stimulate this or decrease this. All you need to do is stimulate the gonadotropin point. The hormonal system sorts it out for itself. So what you're doing is you're encouraging a rebalancing. Again, if it's active, right? Those are a couple points that I think are really key in the hormonal side of things for that. The other, of course, is treating the actual uterus area. Treating the actual uterus area, again, helps a balancing of that organ system so that it's more prepared to perform the task that it's about to perform. The uterus is a large area, and you have, as you can see, these little hooks on the ear just are kind of showing that you're pulling back the helix so that you can expose. It's kind of underneath the helix. Now, one thing you should know is that the ear is a current map, meaning if the organ system that you're looking for is physically larger at that time, the place on the ear will also get larger. Okay, so if you have somebody who has liver cirrhosis and their liver is twice the size of a normal liver, that's going to reflect on how much space it's taking up on the ear. Okay, with a uterus that is at 38 weeks of pregnancy, the uterus itself, the area on the ear, is going to be quite a lot larger than it is in this book. Okay, so you want to look around that area and then see where there is an active point. There might be one or two active points. Okay, it's center line as well, so you can look on both left and right. So treat whatever points you find active in the uterus area. The third element is an element of relaxation. If it's the first time giving birth, or if it's not the first time, but the first time was traumatic, then you could have a lot of anxiety as well, right? And so there are a couple points that are going to be really helpful for the nervous system. One of them is the anxiety point.
Is the same with Shenmen?
Yeah, Shenmen would also help, definitely.
So the worries on the left and Anxiety's on the right.
That's right. Worry's on the left, anxiety's on the right. That is on a right-handed person. And they're both in silver, though you'll find them in silver.
Yes, so would you treat them both? Is it
Um,
making sense, or just treat one?
I would just treat one, and I would check to see which one is active.
On a cancer patients, 99% they both active.
If they're both active, I would treat them both. If those are the priority, like you don't want to just treat everything you find, right? You want to pick and choose what you treat. But if worry and anxiety are both active on somebody who clearly has a lot of anxiety and worry, it appears more physically. It's like you get knots in the stomach, you get short of breath, this kind of thing. It's a very physical reaction. Worry is more mental, right? Worry is more like you can't sleep at night because you keep on wondering about what's going to happen, right? So that's a big difference between those two. And so you can, just with a couple questions, perhaps you can also see like which one of these elements affects you the most.
Would you treat still the worry point on the left side, on the right-handed person? Would you do it still with silver, or would you put gold?
Silver.
Because
Silver.
it's on the left side.
Yeah, silver.
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 Both silver.
Both silver. Yeah.
Regardless of the sides.
That's right. And so you can see in this book, if you have a point that is a filled in circle, like a filled in red circle, that's a silver point. Okay. And if you have a point that is open circle, that's a gold point. Okay.
But David, also the fear point is very close. So
yes,
would you treat that point silver or gold?
I would say that the fear point and the anxiety point are probably pretty close to the same point.
And also, would you treat with silver?
Yes, okay. I would. If you think about a silver point as something that you want to sedate, something that you want to bring down, generally, then that will help you remember which one. So for example, fear, anxiety, that kind of thing, anger, aggression, those are all silver points because we want to bring that down.
And what would you do? I have a case just this week.
Yeah.
There's this man, I couldn't find any gold points, but he had many, many, many points, except they were all silver points. It was very interesting. Even on the back of the ear, he has a prostate cancer. And all of these points were silver, non-reactive at all in gold. Even his prostate point, silver. Strange.
So silver points are very special in the sense that that if you find a physical area in silver, that can indicate that it's a really deeply traumatic psychological issue happening. And so actually those silver points could become even more important and more powerful. You know, so if his prostate is coming up in silver, for example, you know, that might mean that there's a psychological trauma element to that prostate being in the condition that it is.
So from this point of view, all memory points are treated in silver.
The pain memory points, yeah, which are just in that one area, right? Yeah, and then other points like the prostate or the hip or any physical point can come up in silver. If it does on the front of the ear, typically if it does come up in silver, it means that there's quite a strong psychological element to that. And it's very chronic and very traumatic and deep. So that's even more important.
Also, I noticed that if you look at the ear, edge on the back, where the ear meets the skin, I found a lot of patients having many, many points, but I don't see any of these points except the retroceliac in the book. What would this point relate to?
If you look at the meridian points on the ear, there are several governor vessel points along that line. If you go to page 333, there are several points along the governor vessel.
Those exactly points are very active in patients.
And so, you know, this might be a good opportunity to either treat governor vessel points or go looking for a trauma timeline point.
Mm.
You know, just for fun. But even if you find one of those governor vessel points along the ear, along that line on the ear, find the most active along that line that you can, and treat it. You even treat 1 or 2 points along that line, and just see what happens, because it could be very important for that person.
And you would do in silver, because
Those
it's on the back of the ear.
I would check to see if it's silver or gold. I think it could be either in that case. If you're using this in the vase, then you can quickly check, is it silver or is it gold? With the point finder as well, you can quickly check silver and then switch it to gold and check again. Where do you get the strongest reaction? Right?
It's interesting because now I'm reading here that this is DNA point, which makes sense with the cancer.
Yeah, and that governor vessel 4 is a really powerful point.
Yeah.
So governor vessel 4 is right along the same line as the retrociliac point. Retrociliac point is a little further out onto the ear, but it's at the same horizontal line as retrociliac. An antispasmodic point.
If you had someone with serious back problems, who, you know, you're treating along the lumbar on the inside of the ear where the pain is, and you know that there's like stenosis or other things like that, would that indicate going to governor vessel? Because that canal runs right below the governor vessel.
I wouldn't necessarily draw that connection. However, if there are governor vessel points active in that case, then you might think of treating them. But actually, if you go on the back of the ear along the line of the lumbar, what you're going to find is it's not right where the ear meets the head. It's actually out a little bit on the ear. The points in the back of the ear for the lumbar spine, and those will be silver points. And I would look a little further out on the ear on the back for those lumbar points. And actually on this map, a little further out from where the ear meets the head is where the spinal cord is. So the lumbar would be right about here. Okay. And again, it always has to do with what's active, right? And so it always comes back to that. So if you can't figure out where to go looking next, then you can simply go scanning in different areas that you think might be active, and then see what comes up. And just one last point about, you were talking about severe spinal issues. One thing that's really important to think about when you have chronic spinal issues is when you find something on the antihelix at a certain spinal level, say it's the lumbar, okay, and you find points on the antihelix at the lumbar, you also then want to go directly across, okay, horizontal from that, to go just to the helix as well. Okay, the helix is the spinal cord, right? And then just underneath the helix, along this ridge underneath the helix, is what's called the nuclei of origin. Okay, those are like the sympathetic fibers, autonomic fibers of that spinal level. If you have a chronic spinal issue, you're going to definitely find very active points in this area at the same level horizontally from whatever spinal level you're working with. Okay, so if it's a lumbar issue, stenosis, you were saying, you go horizontally across over to the helix. You look for points on the helix, and you look for points in the ridge beside the helix, and you will find very active points there that are going to be very effective at chronic back pain.
Thank you, Dave.
So with that, we've come to the end of our time for now. If you have specific questions that come up, maybe it's about particular conditions and what you might do, or maybe it's about how to find focus activity or something like that, or whatever it is, write them down, bring them. If you have stories from your practice, feel free to bring those, whether they're, successes or questions or whatever. we'll be putting the recordings up. And then there'll be a place on that same course page that you can actually access the recording. And there's also a place on that course page for discussion. On the menu, there's a place that says discuss. And that's just a forum where you can just make comments. And so if you have questions, you can post them there, and I'll be checking that on a regular basis. So instead of, if you have a question, maybe instead of emailing it to me, that you can just put it in that discussion forum. So thank you so much for joining. And
Thank you.
I look forward to doing this again. Be well.
Bye,
Thank you.
bye.
You too.
Bye.
Bye-bye.
Take care, everyone.